kid had a Wims tumor, what will you be looking for? What test that you would do that would indicate there's concern?
What I would do is I would look first at the ultrasound. The ultrasound would show me a kidney mass. If it's Wims tumor, that starts in the kidney. The kidney itself will take up with the mass. I will look for things such as fever sometimes. I look for blood in the urine sometimes. I look for discomfort, so you could have constipation because it'd be a big mass. I could look for some respiratory issues because it could pull up on the diaphragm, and sometimes even hypertension issues or blood pressure issues because the tumor could actually affect the kidney function.
Is it usually one-sided or can it involve both sides?
It can go both sides, but almost always it ends up being one-sided. The bilaterals are small.
So if you had to remove something from that side, there's a replacement function on the other side?
Exactly. The thing that you want to be careful of is, and that's why we end up doing a CT scan, is because what you want to look for is you want to look for whether this involves both kidneys or one, whether it's enlarged enough where it can be taken out or not. And it's interesting because the ultrasound actually helps us a lot in trying to plan what to do with these patients. That ultrasound, if we look for, sometimes a tumor can get in the kidney, can extend up into the venous system. So if we have tumor that actually extends up into the vena cava, which is the main vein that comes up, if it goes up above the hepatic veins, which are in the liver, those patients are at a different stage, and we actually have different treatments for them. So yes, it's important that the CT scan helps us in determining what's on the other side. Because in the old days we used to biopsy the other side, normal or not. But nowadays we look at the CT scan in which to grade whether there's involvement in the other kidney. And if there's not, then we can just deal with the one side.